We're here at ACR 2011, and I'm joined today by Dr. Marcus Owen, who's a private practice rheumatologist in Tennessee. Marcus, thanks for being with us. And one of the questions that I wanted to ask you is, from your perspective as a community rheumatologist, what are some of the key highlights that you're hoping to take away from this conference?
I want to really understand the newest therapies that are coming out, especially for rheumatoid arthritis. That's the area that's most interesting to me. And also learn what's new in lupus, for example.
Now, when it comes to a lot of these different therapies and using the therapies, what do you find are some of the biggest challenges when it comes to particularly like the immunologics and the biologic agents?
One of the most practical challenges is helping patients understand the balance between risk and benefit. Patients are very fearful about side effects. They read the labels, and they sometimes put just as much stock in what they read on the internet from a non-professional source as they do in what I say. Discovering what are the safety signals, what are the danger points we need to look for. So I have seen several of those.
Now, how often do you encourage your patients to enroll in clinical studies?
I actually do not actively encourage them. We don't have our own clinical trials going in our clinic based on its structure, but I help patients understand when they've read a poster or a brochure about a clinical trial what it means for them. Sometimes it's appropriate, other times if they're a RA patient on standard therapy that's working, it's not appropriate to do a clinical trial. I think in the near term there probably won't be a lot of big changes. One of the most exciting areas, and I've reviewed this earlier in a journal club, is that there are small molecules, so oral medications that have similar efficacy to some of the biologics for rheumatoid arthritis, and I think that's going to really be a game changer in terms of cost and patient acceptance of a therapy, a pill versus a shot.